Dr. Christina Mayawaki from University of Houston to tell us more about her experience. Thank you, Christina.
Thank you very much for the introduction. I think it's going to be a good segue because Josh explained what the potential is with the care registry, and then now Janice explained what the care registry is. So my presentation is the implementation of what this foundation is. Next, please. So my project, I'm an associate professor at the University of Houston Graduate College of Social Work. And my project is called Caregiver Provided Life Review. Next slide. So what is life review? You know, everybody does here and there, we reminisce our past, pleasant information. But life review is a structured activity to remember one's past in chronological order. And life review is evidence-based depression intervention for majority of them for older adults. And usually this is conducted by the healthcare clinicians, such as therapists or counselor or social workers. Please. And life review session is held either individually or in group by trained healthcare professional. And session lasts about 6 to 8 weeks in weekly session, and it's about 1 to 2 hours. But because it is held by professionals, it costs a lot. Next, please. So what we thought about, what if we can train caregivers, lay caregivers, this life review therapy, kind of therapeutic activity, can they offer this to your loved one at home? So it is not stigmatized delivery, because sometimes still seeing a therapist is viewed as a kind of stigmatized. And you can deliver this at home, so it's very convenient. And you can set your schedule with your loved one, your availability, and then it is free. So it's very much economical. So that's what we thought this is innovative. Go ahead, please. So the eligibility criteria, we do need this by diets. So one is care recipients, who is an older adult, who is 65 and older. And because this is a depression intervention, we needed somebody who is a little bit of a low mood, not under depression, because you're not the therapist. So we are looking for somebody who is in low mood, and we wanted to try with somebody who has some memory issues. So probably like mild cognitive impairment, or probably like early stage dementia. And we do have pre and post tests. And then they are willing to participate in 6 weekly life review sessions. And another pair is the caregivers, who is a lay person and who is willing to participate in 1 hour online caregiver training. And it's pre and post intervention assessment plus post interview. And just to make sure that you're following life review protocol. So we do have a check-in call with my research assistant, and then 6 week life review session. Next one. So this is the snapshot of recruitment activity. So this study started in August 2020, and this is up to January 2021. This is at the middle of COVID. So we contacted 140 Houston area long-term care facilities by 474 phone calls, 178 emails, and 7 Zoom meetings, but we got only 2 diets. We disseminated 2,000 flyers through Meals on Wheels, but no diets. We did the presentation at 12 local senior and community centers, and we got only 1 diet. And we registered for Alzheimer's Association trial match, and we received 243 inquiries, and we got 10 diets. And on top of that, of course, we did the word of mouth, or we participate in support groups, and we call friends in internship sites with my students. But because this was during the COVID time, so everything was by remotely. Next slide, please. So why we use care registry? Because we didn't have any racial ethnic diversity in the current sample. We had only 1 Asian diet 8 African American, and no Hispanic diet. And trial match, the result is respondent tended to be a little more advanced stage, so they didn't qualify for our study. And also the respondents are hit and miss. We received inquiries, so we set on an appointment, but they didn't show up and things like that. And honestly, we ran out of places to outreach. Next one, please. So this is the recruitment result of Care Registry. So we registered with the Care Registry from May 2021 until January 2023. And the total number of referrals that contacted was 287. And we received inquiries from 27 caregivers, and total of registrants screened was 20, but 8 was ineligible. So the registry, the final registrant from the Care Registry was 12 diets, and they are the ones who participating in our study, and 11 diets completed the study. So in the Care Registry, they'll tell you what kind of method they would like the initial contact to be. And majority of them are email contact, and few of them ask for text message, and few of them ask for USPS mail. So we send study flyers by USPS mail. Next one, please. So the experience of using Care Registry, as Janice explained, it's very, very easy registration process. It's just one-time registration. And then I think I met once to explain a little more in detail, but it was very simple form to fill out. And also, once you request a list of care registrant, it's pretty quick turnaround time. Say if I request it today, I usually receive it by this Friday or maybe next Monday. But I knew there are several times that I really need it in rush. So I requested a rush, and then I received it within 2 days. So it was very easy, and it was target time. So I can kind of calculate when I should be receiving or when I would expect to receive the registry. And again, once you receive the list, the instruction was easy to follow. There is even a template of email how you can send it. So we just have to use the template and then tweak here and there, cater toward your research project, and we follow. As Janice explained, that every week we follow. Say if we send the email today, we'll send the second one the next Monday, and then the third one is another following Monday. So that's the weekly email schedule, and very, very easy to follow. Next one, please. So having gone through several care registry, I could see characteristic of care registrant. All these ANAPI people who are interested in research, so all the people that we receive, they already know that if we contact, they are the one because of care registry. And because they are interested in participating in the study, they are very much reliable and they are committed. So we know that once they're in our study, we know that they'll complete the study. So it was very much, we can count on these people. And also, as Janice explained, that we have so much diversity in ANIPI populations. So we receive a variety of people from ANIPI ethnicities. And there are, in our case, majority of them was English speaking in an ANIPI. But there are others who chose a different language other than English. Next one, please. So, but I would like to report some lessons learned and some challenges. As everybody is, if we don't have any deadline, we don't act. So what we learned is that when you're sending email to registrant, we put response deadline. So say we send it today, most likely we will receive some responses today or maybe tomorrow. Or the day of the due date or maybe few days before the due date. So we learned that several trials, I think it's better to put some kind of due date so they have some target that they are aiming at. So that was a lesson that we learned. And also, when you hear from the registrant, we immediately respond to them. This timely manner is very important because they're expressing their interest. So we really need to catch that right there. And then once you have the communication with the registrant, we need to communicate them often so we can keep their interest, and then we can recruit and we can have them in our sample. But sometimes we have to be very careful and sensitive to cultural difference, even if within AA and IPI ethnic groups. So those are the times that we contacted a native speaker of that particular ethnic groups, and we learn basic cultural mannerism. One thing that we learned is the care registrant, they are the English speaking, they may be the second generation people, so they know how, they may be familiar with participating in the study or the participation in the study in the representative of AA and IPI. That's the concept that they may know. But the difficulty is, for example, our study was looking for diets. So the care registrant was fine, they want to participate, but they are looking for, they want to do the study with their, say, parents who may be the immigrants, so they may not be familiar with participating in a study. So that was the challenge. So I think we need to encourage non-English speaking AA and IPI to participate in the study. That's going to be the next challenge. Next one, please. Okay. What I wanted to say is when Josh mentioned that with this care registry, I would be able to recruit many API registrants and then the diets into our study. We almost have the same number of white sample. So we are planning to compare this API group versus white group to see if there are any differences in the result. So I'm really thankful for care registry because without them, I don't think we are able to include AAP and IPI representatives. So I'm very thankful. Thank you. And I think I'll keep requesting more care registrants. Thank you.